Post-nasal drip. The best treatment options. Post-nasal drip occurs when excess mucus accumulates in the back of the throat and creates the feeling of dripping mucus. The condition can lead to a chronic cough or a sore throat. The treatments for post-nasal drip focus on the cause of the excess mucus, which may be an allergic reaction or non-allergic rhinitis. A visit to a physician to determine the cause of the condition is an important first step to alleviate post-nasal drip. Removing allergens from your environment. Remove allergens from the environment when possible. Allergens such as dust, pollen, pet dander and mold can irritate the nasal cavity and lead to post-nasal drip. Bathe pets to remove dander that may cause an irritation leading to post-nasal drip. It may be necessary to remove pets from the home if the allergic reaction and post-nasal drip is severe. Remove flowering and non-flowering plants from the home. Enclose unused pillows and mattresses in plastic to minimize allergens while sleeping. Use an air purifier to remove allergic irritants from the environment. A humidifier can add moisture to the air, which relieves the irritation in the nasal cavity. When the nasal cavity is irritated, it produces excess mucus as a response. Consult an allergist or take an allergy test. Chronic post-nasal drip could be caused by an underlying food allergy that you don't yet know about or have recently developed. Check with an allergist to see if you could be allergic to something and not yet know it. The two main allergies are to gluten, wheat and dairy. Dairy is often linked to sinus, upper respiratory, and throat problems, while wheat is often associated gastrointestinal tract problems. Since dairy is a likely culprit, phase dairy out of your diet for 1 month. If you experience no change in your symptoms, you've ruled out dairy as a possible allergen. If you experience an improvement in symptoms, you know that your body reacts to dairy by producing more mucus, although studies indicate no clear link between dairy and mucus production. Using doctor-recommended treatments. Drink plenty of fluids to remain hydrated. Dehydration can aggravate the symptoms of rhinitis and post-nasal drip. Avoid caffeine and alcohol, which can cause dehydration. Water is the best choice to remain hydrated while suffering from rhinitis and post-nasal drip. Look at your urine to determine if you're getting enough water during the day. If your urine is yellow, you're probably not getting enough water. If your urine is clearer, with at most a hint of yellow, you're probably drinking enough water. Blow your nose frequently to remove excess mucus in the nasal cavity. Blowing the nose can remove irritants, which causes a buildup of mucus. For mucus that cannot be cleared after blowing the nose, some people prefer snorting and spitting the excess mucus from the back of the throat, avoiding bad breath and dry mouth. Rinse the nasal cavity to remove mucus-causing irritants. Over-the-counter saline kits and nasal sprays are available to rinse the nasal cavity. The saline solution flushes the irritants from the nasal cavity, thins the mucus and relieves the membranes in the nose. Try using a neti pot to clear out the mucus in the sinus and the back of the throat. Be aware, however, that by using a sinus irrigation device you could be removing natural antimicrobial agents that get rid of enemy bacteria, viruses, and fungi. Use over-the-counter decongestants to relieve the symptoms of excess mucus buildup and post-nasal drip. Oral decongestants narrow the blood vessels to reduce the amount of congestion in the nasal cavity. Decongestants are also available in a nasal spray. Use decongestants for only 3 days in succession. If symptoms don't get better after 3 days, discontinue use of decongestants. Use of decongestants after 3 days may be more harmful than helpful. Remove mucus with mucus-thinning medications. Medications such as guaifenesin, Mucinex, are sold OTC and taken in tablet or syrup form. Ask your doctor for prescription medications to relieve irritation and mucus buildup. The physician can prescribe corticosteroid, antihistamine and anti-drip sprays to relieve post-nasal drip. Corticosteroid sprays treat the inflammation that occurs with non-allergic rhinitis. Antihistamine sprays can effectively treat allergic rhinitis causes of post-nasal drip but are not effective for non-allergic causes. Anticholinergic or anti-drip sprays are medications used in asthma inhalers, which can help treat post-nasal drip as well. Using unverified natural remedies. Make a saltwater gargle. Add half teaspoon of salt to 8 ounces of warm or lukewarm water and gargle after lifting your head back. To help cut the mucus even more, add the juice of half lemon to the saltwater and gargle. Do a round of house cleaning. If allergens are haunting your sinuses, the only home treatment you may need is a treatment of your home. Try the following suggestions to remove dust, pollen, and dander from your residence before they come back to bite you in the nose. Wash your clothes, sheets, pillowcases, and mattresses in hot water regularly. Hot water will kill any bacteria that may be causing your symptoms. Use HEPA air filters in your home. HEPA stands for High Efficiency Particulate Air, and is an industry standard tested by the government. Vacuum regularly with true or absolute HEPA filters. Vacuuming with HEPA filters ensures that any allergens are picked up during the vacuuming process. Avoid caffeine, alcohol, and spicy foods. All three may make mucus production worse. Use steam treatments with herbs or oils. Try out a DIY steam treatment by covering your head with a towel and placing it a safe distance from a pot of warm water. Make the steam treatment aromatic by adding tea, ginger, mint, or chamomile, for example, or essential oils, lavender, rosemary, etc. Take a warm shower. Let the steam of the warm water work its way into your lungs and sinuses while you bathe. Try the lime cure. For this you'll need 3 cups of tea, 1 huge cup, and hot water. Add sugar to taste and a little honey. Squeeze in the juice of half dark green lime. Drink this concoction first thing every morning without food. The lime will clean your liver and your stomach, full of last night's mucus due to the post-nasal dripping, and you'll feel lots of energy throughout the day.